Global estimates by the World Health Organization have shown that nearly 150 million new cases of bronchiolitis occur annually. So, for the time being, bronchiolitis is known as a leading cause of hospitalization in babies. Bronchiolitis is a common lung infection affecting small airways called bronchioles in infants and children younger than 2 years of age. The disease is almost always caused by a virus, and occurs in the fall and winter months more than other times of the year. Although the disease is often self-limited, 7 to 12% of affected children experience severe form of the disease and need hospital admission. The respiratory system begins at the nose, and continues through the lungs. Lungs are spongy air-filled organs, containing respiratory passages called bronchial tree. The smallest branches of bronchial tree are so-called bronchioles. In bronchiolitis, the lining of bronchioles is irritated, inflamed, and congested by cold or flu viruses. Respiratory syncytial virus or RSV is known as the most common cause of bronchiolitis, accounting for nearly 50 to 80% of all cases. The virus is extremely contagious, infecting almost 100% of children by age 2. RSV spreads among children through contact with droplets from the nose and throat of infected people when they cough or sneeze. In addition to RSV, many other viruses such as coronavirus, rhinovirus, adenovirus, influenza and para-influenza can cause bronchiolitis as well. The early manifestation of bronchiolitis is similar to a cold. It starts out with upper respiratory symptoms like sneezing, coughing, runny nose, stuffy nose, mild fever and loss of appetite. A couple of days later, the disease progresses to lower respiratory symptoms, causing breathing difficulties like noisy breathing or wheezing, shortness of breath, nose flaring and breathing more quickly. Breathing difficulty is a sign of bronchiole involvement. That's because inflammation, congestion, and mucus overproduction narrow bronchioles and therefore impair ventilation and alter balance of blood oxygen and carbon dioxide. In summary, the presence of upper respiratory symptoms, followed by lower respiratory symptoms particularly wheezing, in healthy children less than 2 years of age is suggestive of bronchiolitis. There is no specific blood test or imaging for the diagnosis of bronchiolitis. The diagnosis is often made based on the child's history and physical examination. Sometimes laboratory studies are used to rule out other diagnoses including pneumonia and blood infection. Although majority of cases are self-limited and resolved by the passage of time, hospital admission is needed in severe cases. So, it's essential to be well aware of the red flags of severe bronchiolitis. Breathing very fast and shallowly, usually more than 70 breaths per minute. Labored breathing. In this case, the chest sinks in below the neck or under the ribs while the child inhales. Drowsy or floppy appearance. Poor feeding. That's because the child breathes too fast to eat or drink. Nose flaring, and skin color changes, in which lips and fingernails turn blue being so-called cyanosis. This is as a result of low oxygen levels in blood. If your child has any of these signs and symptoms, seek medical attention immediately. Thanks for your watching. Please let me know the pediatric issues you are willing to learn. Write them in the comments for me. Have fun.